Welcome back to Medical Talk on ESPN 760. Steve Politziner, Dr. Jonathan Cutler from the South Florida Foot and Ankle Centers. We'll be doing this each and every month, talking about some of the most prevalent and serious injuries going on that affect everything from the professional athlete to the weekend warrior. We're lucky enough to be joined by orthopedic surgeon specializing in sports medicine, Dr. Marc Matarazzo, who's joining us this week, talking a lot about the knee. Had a really fascinating conversation, learned more about the ACL than I ever thought I would want to know. But you know, in today's day and age, whether you're a weekend warrior, whether you're a fan of a team, if you play fantasy sports, we even know there's a couple people that wager on games from time to time, hopefully by all legal means, want to know what all of this stuff means, and I've really gotten a great education about what happens with the knee, what the basis of the knee is, why an ACL injury occurs, what immediately happens when an ACL injury occurs. Now let's talk about the actual surgery, and John, and then this rehab, because everyone's always wondering, why does it take so long? Why are these guys out so long? Where are the advancements in medicine like there have been in so many other injury treatment and rehabilitation?
And you know, one of the things that we hit on before is that, you know, I think you brought it up, is that the person gets the injury without contact. It just happens in midair. You lose it. He plants, as Dr. Matarazzo said, he plants and then the knee goes. Well, it's not only for football that we talked about. I mean, we all know Derrick Rose, same type of thing. I mean, basketball player was sitting there, just jumped up in the middle of his jump, went down, and probably one of the best players in the NBA, arguably, is out for the year. So I think it's important for the weekend guy to work. You know, it does happen to the top athletes where you're just sitting there and it happens. And I think that we have discussed everything, and the rehab is really where we're at now. And what's the average guy looking for rehab? What's the time that he's going to rehab? And you know, let's say Steve and I play basketball against each other, and sometimes he actually makes a move on me, and then I have to sit out for a while. What's the sit out time for this type of injury, the ACL? What's the rehab, and what's the whole total time in general?
Okay, it's a great question. You know, we like to say things in orthopedics are cyclical. So, you know, we do things one way, and then we go back to doing them the way we used to do them, and then we have a new way to do them, and then usually we go back at some point and do them again like we used to. So, you know, typically 6 months was a good time to get back to you know, cutting and jumping and twisting after an ACL reconstruction. Some guys were really pushing the envelope, and you know, not too long ago, people were trying to get back in 3 and 4 months even. Now things are shifting a little bit more toward a more conservative approach. I would say generally people are getting back at between 6 and 9 months. I was at a big conference last year up at the University of Pittsburgh. We spent 3 days talking about the ACL. The conference was on ACLs. And the vast majority of surgeons, we all agreed that you know, possibly we're getting these patients back a little too quickly. The graft is not mature, it's not strong enough, and that's maybe why we're seeing, you know, more failures than we would like to see.
Is an ACL prone to rupture again, more so if it already has had a previous rupture?
Interesting question. Actually, there's a higher risk of injuring the opposite ACL than the one that's reconstructed. And that's after, you know, that's after proper rehab and a successful return.
And is that because more weight is being put on the other one as a result of the favoring the other leg?
I think it's controversial. I don't think there's any one reason why there's no one reason we've identified for that, but it just happens to be that.
Do you have to wear a brace after that? I mean, is that one of the reasons maybe we don't re-enter that again? Is that guys wearing that brace all the time?
Yeah, braces are, you know, controversial. Some people will put some surgeons will put their patients in a brace afterwards, and some won't. I typically will prescribe an ACL brace just for protection up to about the first year. And then after that, if things are going well, I'll allow them to get out of the brace if they so desire and they feel strong enough
Dr. Matarazzo, take us into the rehab for a second, because you see stories on ESPN about the best athletes in the world, and they're struggling to do one leg extension at 10 pounds. What is going on there in the actual leg itself, and what happens in the rehab?
Right. Well, first of all, the knee is undergoing a significant trauma when you reconstruct the ACL. You're drilling bone tunnels, or you're drilling holes in the bones to put the graft in the tunnels, and the graft has to heal to the bone inside the tunnels. So you're generating a lot of pain, a lot of inflammation, and a lot of blood in the knee. Once the knee fills up with blood or has fluid inside the knee, the quadriceps muscle, or your anterior thigh muscle, generally will shut down. In other words, the electric activity will be significantly diminished, and the quadriceps will essentially atrophy, or it'll soften and get smaller. So that's why it's really critical to work on strengthening after an ACL, because obviously you want the muscles around the knee to be as strong as possible so that they can protect the ligaments. They add stability and add protection to the ligaments. So, and it's very difficult to get that quadriceps back, and that's what a lot of the therapy is based on, and that's the aim of it.
One other as we kind of move from the ACL, or staying on the ACL, but move to some of the more buzzworthy topics these days. John, you hear about microfracture surgery was the big one for a while. I remember Terrell Davis was kind of one of the guys that was most associated with never making the comeback when he was on the top of his game in the NFL. But now you're also hearing a lot about the stem cell therapy and blood spinning. And you've heard names, some of the biggest names in sports have chosen to go overseas for some of these procedures. Is it, John, they're just not, these procedures don't have enough testing to be approved in the U.S.? And of course, we want to hear Dr. Matarazzo's take on all that as well.
Well, that's a hot topic right now, as you said. It's stem cell therapy. It's what they call PRP, platelet-rich plasma therapy. And there's all these different types of things that are going on. And I think what happens is, Steve, these are not studied that much in this country yet. And it tends to be, the U.S. is very slow on getting new medicine in here, where Europe and other countries are much quicker in utilizing those techniques. But I do know that PRP is big here. Stem cell therapy is big here. And no significant studies that I know of, and maybe the doctor over here can help us out with that, have really shown the benefit. I can tell you on a personal note, I recently had my shoulder done, and I looked into it. I asked the doctor, who goes to lectures all over, and no real solution was given. In fact, I was listening to a doctor's show similar to this, and basically the week before the surgery, the gentleman who does the shoulder surgery at NYU Medical Center basically said he uses it only when asked for, because he can't justify the cost of it to someone who may or may not help. So if they have the money and have the resources to do it, that's when it's used. And I'd like to hear your view on that, Doc.
Great topic, very complicated, actually. You mentioned stem cells, and you mentioned PRP. Very different types of therapies, similar indications, similar injuries or conditions can be treated by them, but just very different types of treatment options. But they are biologic, and they are natural, and they're safe. So they do fall into that category, and they are similar in that regard. PRP, or platelet-rich plasma, is basically taking one's blood and spinning it in a centrifuge, and you are concentrating the platelets, the platelet part of the blood, into a small amount of plasma that can be re-injected into an area of injury or into an arthritic joint. There is a lot of, the issue is that there are a lot of different preparations of PRP, and there's been a lot of different indications for it, And there's been a lot of different protocols which have not really been standardized. So one man's PRP may be different from another man's PRP because of the preparation, because of the concentration of the platelets, white cells, cytokines, these types of chemicals that are in the plasma. So that's why it's been very difficult to study it.
And who are some of the athletes that have done that?
Well, probably the most known athletes have been going to Germany for what's called an orthokine procedure, which is where they're taking the serum of blood and they're incubating it to increase a concentration of a cytokine or a chemical in it that has a superior or a supposedly superior anti-inflammatory effect, and that's called interleukin-1 receptor antagonist. The problem, and the reason they're going to Germany is because the incubation process is not allowed, it's not FDA approved in the US. So,
And just, is it dangerous? Are there drawbacks or just not enough research?
no, and in fact, some of the funding to research those projects came from the US. So it has not been shown to be dangerous in any way. You're not adding, outside chemicals. It's strictly the patient's blood, and it's very safe. And actually, in the U.S., we are able to replicate that to some degree with a photo activation LED light, and we're doing that currently.
So will that be something that you see eventually being a more common treatment in the U.S.?
I think it's going to be extremely common, at some point.
All the way down to the weekend warrior?
Absolutely.
5 years, 20 years?
I think 5 years is probably a good number. I think we're going to make. I mean, there are multiple studies coming out every week and every month, and it's just a matter of sort of standardizing things, and we have to continue to study the molecular biology, and I think it's the wave of the future.
It's one of those things that I think works for a lot of people, but we just don't know why yet. So that's the reason that the medical community is not going full force.
And then I assume also you got insurance companies that are a big part of this. We haven't really gotten into that. I don't think anyone wants to be reminded about where insurance companies weigh in, but I think it should be noted that is probably part of the holdup, is that these are all thousands and tens of thousands of dollars. I mean, I couldn't even guesstimate just what an ACL procedure, top to bottom, costs, rehab, hospital time, everything.
You don't have enough time on this show to talk about that.
Well, that's a great point, and just let me make this one point. These PRP injections are treating patients, and they're essentially we're doing surgery without the surgery. So if you take all of the factors involved and you analyze them, the patient's not coming out of work. The patient is not in rehab. The patient doesn't need specialized equipment at home. They're not, off their feet, or they're not, not performing daily activities. So I think if you take all those into account and the procedure is working, I mean, you're actually saving so much money in the grand scheme.
But just to be clear for the layman, this wouldn't be in lieu of an ACL procedure. If you tear your ACL, you tear your ACL.
Right. At this point in time, an ACL reconstruction is the gold standard. Now people are augmenting their ACLs. Now, we can get into
people with multiple arthroscopic surgeries or have no ligaments left, or
right. You could, I think at some point, hopefully we'll just put a scaffold in and stem cells, and we'll just regrow a normal ACL. Certainly that's not here, and that's a long ways away, but I think that's something to shoot for.
And I think stem cell is a natural segue. Stem cell, you had mentioned, is a completely different area, also another controversial area. Again, educate us, because we hear these words and these terms and know there's a lot of debate about them.
Right. So stem cells would be harvesting basically worker cells. These are cells in your body that have not been programmed yet to do what they're supposed to do. In other words, they're like students at college, and you can put them in different tracks. They can They can go into law, they can go into medicine, they can go into engineering. And all they need is to be stimulated to go down one track. So if you harvest these cells and you put them where you want them to be, and you stimulate them the right way, these cells will go to work and build tissue and decrease inflammation, and that's how stem cells work.
I think that's the key too, is in both of those, is to decrease inflammation. That's what gets these people back together. In fact, Heinz Ward had an injury at the same time as Palomalo did, where the injury occurred because, or he attributes getting back to the field because of those therapies that he underwent.
Great, interesting. So this debate is going to rage on as well as far as legality, and I guess it's not as much about the legality and the approvals as it just the proofing process that these are worthwhile, these are healthy, and then they become generally accepted.
Right. Legality is an issue for certain techniques. There are companies that have been incubating the cells, and the FDA is just not allowing us to incubate cells.
I think this could be almost a whole show.
A separate,
on the new treatments that go on, as far as how we can get to heal tendons and soft tissues by decreasing inflammation.
I feel like you're trying to ask Dr. Matarazzo for a return visit. I think
love
you're
to.
already trying to rebook him. Lastly, Doc, before we let you go, I'm a weekend warrior. I'm a parent of a kid. Are there some suggestions from a prevention standpoint, from a how to be careful standpoint, to ensure that you're giving yourself the best chance to succeed athletically without putting yourself in a compromising position?
Well, the first thing I always tell patients is that, if they're going to compete, they have to prepare. So just like a professional football player, he's not going to sit around all summer and then just show up to the first game and start competing at that type of level. If you know you're going to compete, you have to work certain muscles that you're going to be stressing. You have to stay limber, and you have to prepare yourself for the stress that your body's going to take. There are prevention programs, and therapists are well versed in these types of programs, and they can put patients through certain exercises and re-education of muscles and landing mechanics, and these can certainly help prevent injuries going forward.
Well, great. It's been really, really interesting today, John.
Steve, I don't think we could have had a better first show.
I agree.
Or with a better person to have it come.
I almost want, I don't want to jinx it. I almost want to hurt my knee just so I could go to Dr. Matarazzo.
I'm with you.
By the way, you can learn more about Dr. Matarazzo and everything that his practice offers at ocpbc.com. That's ocpbc.com. If you're local, it's 561-967-6500. So Dr. Matarazzo, really fascinating and very educational. We thank you for joining us today.
Thanks, guys. I appreciate it.
You were great.
Good time.
You were great.
John, man, learned a lot today about the knees. Everything from prevention to some of the terminology and what the future, and as well as what the future looks like. And I hope we'll both make better choices in how we prepare for our regular basketball games to the players we select on our fantasy football teams.
I think you're right. I think the knee is such a complex joint, and I think Dr. Matarazzo brought it down so basic for us that we now can go forward and help try to prevent it ourselves with some of the techniques that he said, and hopefully we don't have to see him for that. I'd rather see him for other reasons than that.
That's right. Well, thanks for joining us today, and we hope you'll join us next time on Medical Talk on ESPN 760.